In summary, we have now reviewed prostate cancer grading, clinical staging, relative risk, and many of the common treatment options. It's important to be positive and optimistic about your prostate cancer options and about the treatments. Take your time to make a decision. Seek other opinions, particularly from other urologists, radiation oncologists, medical oncologists, and your primary care physician. Remember, there is always some inherent bias when you speak with specialists. Each specialist is an expert in their own field and oftentimes feels that their treatment option has certain advantages over other treatments. Understand that all treatment options have risks, side effects, and potential complications. In looking at the various treatment options, keep in mind that there are potential short-term risks and long-term risks associated with different treatments. Radical prostatectomy, for example, involves a major surgical procedure, and therefore there are immediate potential risks such as bleeding, infection, blood clots, pulmonary emboli, and even possible perioperative death. In the short term following radical prostatectomy, urinary incontinence is likely, but over time it would tend to gradually improve for the vast majority of patients. It is interesting that my data shows that approximately 1/3 of patients have good continence right after surgery, and over the next 6 months, nearly 99% of the patients become continent. Erectile dysfunction is a very common side effect of radical surgery, and if a bilateral nerve sparing procedure is performed, erectile function can return, but this may take months and even sometimes up to 1 to 3 years to return. Always remember that after radical prostatectomy, there will never be ejaculation, but one can reach an orgasm even without an erection. Surgery also involves the potential risk of injury to surrounding tissues, such as the rectum, the bladder, the ureters, etc. Long-term risks of radical prostatectomy would include scar tissue formation, which might require surgical intervention to dilate or open up an obstructed pathway to the bladder. Urinary incontinence can be chronic or long-term, although treatment options are available for this problem if it persists. And erectile dysfunction certainly can be permanent, and again, treatment options are available for this. Keep in mind that if radical prostatectomy does not completely cure the cancer, radiation therapy can be done following surgery. Similarly, radiation therapy will have short-term side effects and potential long-term risks or side effects. If one has a very large or obstructing prostate and has difficulty passing urine, radiation may not be the best treatment option. In that case, radiation treatment could potentially make those symptoms worse. In the short term, radiation can affect the surrounding normal tissues such as the rectum and bladder and cause irritative gastrointestinal symptoms or diarrhea, and can also cause increasing urinary frequency. One can have increased trouble urinating during treatment, and these types of symptoms may require medications during or shortly after treatment. In the long term, erectile dysfunction can be a significant factor with radiation therapy. A large percent of patients, roughly 50%, are estimated to have some degree of erectile dysfunction 3 years following external radiation therapy. Brachytherapy, on the other hand, has the best erectile dysfunction outcome with a lower incidence than both surgery and external beam radiation. Urinary obstruction or incontinence may occur in the long term, and if incontinence occurs, it can be a very difficult problem to deal with. For example, if one has an obstruction to the urethra from a prostate that has been irradiated, doing surgery on the prostate carries significant risk and may result in either scar tissue formation or serious urinary incontinence. The other thing to keep in mind with radiation therapy is that further options for treatment may be limited if one has radiation. For example, if one has radiation therapy, it may be either impossible or very difficult to safely remove the prostate surgically. For that reason, very few doctors currently recommend what would be called a salvage radical prostatectomy in someone who has undergone previous radiation.